Imagine a situation where a nursing home resident, let's call her Margaret, has her daughter pull her weight chart during a nursing home visit. 15 pounds gone in 90 days. She asks the charge nurse, and the answer comes back fast, light, and practiced. Oh, weight loss is very normal in elderly patients. Nothing to worry about. 15 pounds. There's no physician note in the chart, no dietitian consult, no care plan change, no call to the family, just numbers sitting in a record while the facility bills Medicare for nutritional care. It doesn't really look like they're providing. I'm David Terry, nursing home neglect attorney in St. Louis, and I handle cases all over Missouri and Illinois. In 25 years of advocating for elderly residents in nursing homes, I've seen many cases just like Margaret's. Weight loss is not the real issue here. The real issue is, what did the nursing home do about it, or what did they not do about it? Margaret's chart probably has the answer, but the facility is hoping that the family never sees it. Now, a nursing home that accepts Medicare or Medicaid is required by federal law to maintain acceptable nutritional status for every resident. That means a care plan built around the resident's actual needs, things like caloric requirements, swallowing difficulties, dietary preferences, everything that affects how they eat. And when a resident starts losing weight, the facility is required to identify why. And then they have to document what they found. They have to adjust the care plan and involve a physician and a dietitian, and they have to notify the family. Federal regulatory rules provide that the clinical threshold is 5% of body weight in 30 days or 10% in 180 days. Now, when a resident crosses either line, the facility has to act, not eventually, not when it's convenient. They gotta act now. So the question is never just, did they lose weight? The question is, what did the facility do when the weight started dropping? Now, a good facility will show you their chart. Here's what we did, when we did it, and here's what we're doing to address the problem. A facility that has only documented weights and nothing else, that's a facility that tracked a decline and then they just let it happen. Now, if you're concerned, request the weight logs, the meal intake records, the dietitian notes, the nutrition section of the care plan, and the physician progress notes. Make that request in writing. These records exist, or at least they're supposed to exist, and you want to get a hold of them if you can. Families often notice the signs before they connect them to weight loss. Mom's clothes may hang a little bit looser. Her face may look a little more gaunt. Dad's arms and legs might look a little thinner. There may be untouched food on the food trays, and drinks may be out of reach. They may have dry lips or more confusion or more fatigue. A general sense that your loved one is fading faster than the diagnosis alone would explain. A resident who seems more confused or lethargic may not be declining from dementia, may not just be part of their disease process. They may be declining because they're just not getting enough calories, protein, or hydration. The nursing home may tell you, well, it's just the progression of their disease. But the decline that you're witnessing may actually be progression of the neglect by the nursing home. Nursing homes will often try to blame the resident, telling the family member, well, he refused to eat, so we can't be blamed for the weight loss. And look, that may be true if they can demonstrate that they tried alternatives. A nursing home has a duty to work around a resident's refusal to eat sometimes. They need to look at their preferred foods or maybe adjust the timing, give them supplements, proper positioning during meal times. They need to talk to the physician about appetite. Food refusal is a clinical problem to manage. It's not a reason to document a missed tray and call the decline inevitable. So if you're a family member, keep a written log of what you observe on every single visit. Were the meals untouched? Was Dad's water out of reach? What is the facility doing to address the problem? And when the chart and the family's notes don't match, that's where the truth sometimes starts to come out. Malnutrition often does not stay isolated. It can set off a chain of events that can be deadly. So protein deficiency destroys the skin's integrity. That's how a malnourished resident develops pressure ulcers or pressure injuries, even when they're being repositioned. Low caloric intake reduces a resident's muscle mass, which means more falls. They're weak, so they fall more. A compromised immune system from undernutrition makes residents more vulnerable to infections, including urinary tract infections that lead to sepsis. If your loved one has lost significant weight and is now dealing with a wound, a fall, a fracture, or a serious infection, don't look at these as separate events. They're all likely related, simply a cascade of events, often starting at their nutrition. Now look, I want to be very clear, not every weight loss case is neglect. A resident with advanced cancer, end-stage heart failure, or very advanced dementia just may lose weight despite real and documented effort. And sometimes residents just kind of decide that they're done and they quit eating. So here's the test. If the facility can show you regular monitoring, physician involvement, nutrition follow-up, care plan changes, and family communication, that's a nursing home responding to a difficult medical problem. If the facility can show you the weight numbers, but not a coordinated response, that's when quote-unquote normal aging starts sounding less like an explanation and more like a cover story. Now, one other thing. Sometimes residents don't eat because the food is, well, gross. So try this. Assuming your loved one can eat normal food and is not on a special diet, stop by their favorite fast food place and bring it to them. If they eat a Chick-fil-A sandwich with no problem, the likely source of their weight loss is the facility's food and not their disease process. One of the biggest mistakes family members make is believing what the nursing home tells them. I can tell you from 25 years of experience, many nursing homes have no problem lying to you to protect themselves. If they did something wrong and they can keep you in the dark by lying to you, many of them will, no problems. Your best weapon is the chart itself, and the best place to start is the care plan. Now, for more on how care plans affect a resident's care, watch my video on nursing home care plan failures, where I walk you through what a real care plan looks like and what it means when it never changes while the resident declines. I'll see you over there.